While information infrastructures at the bedside have become more sophisticated, not all advances have improved outcomes, and many advances have actually increased healthcare costs. Additionally, many of the promised patient safety benefits of healthcare information technology have not been realized. Finally, the delivery of care and safe, effective care is influenced by the limitations of the humans engaged in providing this care. Information technology impacts every aspect of the healthcare system. The point of care is often called the sharp end of care, meaning it is the area where the care is provided. The sharp end of care and the unit comprise the clinical microsystem, which is a small group of people who work to provide care to a group of patients. These microsystems are embedded in the larger organization. The healthcare system, or blunt end of care, includes communication with patients and other providers using some form of health information exchange, such as a patient portal. Specific information technology tools are used at each level of care that improve patient safety. Errors happen in life and in healthcare, but healthcare providers do not start their day planning to make an error. It is important to identify and prevent errors, since errors may result in harm. An error occurs when an incorrect action is taken that may result in patient harm. Most errors result from the deficiencies in the system of care. The Swiss cheese model describes how most errors in healthcare occur. According to the model, the probability of error increases when the number of gaps increase and the number of safety barriers decrease. The addition of safety barriers, along with minimizing safety gaps, provide protection and reduce the risk of an error occurring. Not all errors are caused by gaps in technology. Some occur because individuals take incorrect actions despite having the knowledge of the correct action. The more holes in the cheese, the more likely that the incorrect action will result in an error. A rules-based error occurs when a good rule is applied in the wrong situation. An example would be when a drug is shown to be effective for the condition, but the individual is allergic, and yet the order is entered to give this medication despite the allergy. Knowledge-based errors occur when two intravenous medications have been ordered to be administered at the same time, and they are mixed because the individual does not know that they are incompatible. The introduction of clinical decision support systems into the information technology system is a good way to eliminate or at least decrease the risk of these types of errors. Your text shows a table of information technology systems and the type of error addressed by each system. There are many technological advances to improve patient safety at the point of care. Physiologic monitoring systems must have some basic requirements to be successful. If information is to be automatically stored and exported to the electronic record, then the system must be compatible with the electronic health record. The system generally has alarms that indicate the equipment has gone out of range, such as high or low pulse or low blood pressure or high blood pressure, and that audit for the system is appropriate functioning, such as the smart pump alarms that indicate a change in the flow of fluids. Alert fatigue occurs when false alerts occur frequently. Staff members experience a lack of responsiveness to them. This results in a cry wolf bias to responding. No matter the type of technology or built-in safety features, no alarm should take the place of the licensed caregiver who is able to interpret and act on the change indicated by the alarm. I encourage you to read and reflect on the assigned article on alert fatigue. Connection to larger information networks is necessary for storing and sharing health information. Networks can be hardwired or wireless. Central monitoring stations receive real-time hemodynamic monitoring feeds from multiple patients, decreasing the risk of inattentive omissions and knowledge-based errors. Unit-based information sharing utilizes devices including smartphones that are used for communication and assessing patient data away from the point of care or the bedside. Note that medical devices must be associated with the appropriate patient and make the right associations to avoid errors. Data from medical devices can be transmitted to the electronic health record and connected to a larger network which allows for data storage. Manual data entry increases the risk of errors by inaccurate data entry. The difference in time between the actual clinical event and the documentation of that event also introduces the risk of error when the event may not be accurately recorded in the record and critical information may be lost. Data entry must be completed in a standardized format for the data to be useful in the future and is dependent upon the system design to be accurate. Downtime is a period during which all or part of an organization's health information technology is unavailable. Planned downtimes are used to upgrade or provide system maintenance. The planned downtime is often during hours of least use and are usually announced days ahead of the event so that staff have time to prepare. These downtimes rarely cause major interruptions in care delivery or documentation. However, an unplanned downtime is often caused by a system failure, a power outage, or a natural disaster. Many safety risks occur during an unplanned downtime, and organizations have specific plans to minimize these risks to patient safety. Staff are trained on these procedures and have a comprehensive downtime plan as the best way to mitigate patient harm. Smart IV pumps house a library of medications and corresponding concentrations and safe dose ranges. They have soft stop or hard stop alerts if a dose exceeds the programmed limits. The library can be tailored to a specific location, such as ICU, OR, or a medical surgical unit, and provide data on care process and provider behaviors. Problems occur when information is not updated or the pump is incorrectly programmed. Barcoding medications was required by a 2004 FDA rule. Barcoded medication administration can be implemented at the bedside, and safety processes are embedded to double-check the order, provide educational tools to support medication administration, and to include alerts and warnings that are specific to the medication regimen and the individual patient's condition. Barcoding of materials can improve flow and improve safety. This type of barcoding is used in the management and documentation of operating room supplies so that specific information associated with surgical devices can be traced back to the surgical event. An example of the importance of barcoding is through the barcoding of medical services. Medical device safety is regulated by the FDA through established guidelines for medical device design, testing, and error reporting. The risk of use of medical devices and reporting of device malfunction to the FDA is required by law. RFID technology is used to give more detailed tracking information, including prevention of retention of foreign bodies within the OR and to monitor the flow of patients throughout the hospital. Expiration date tracking is another useful way to use barcoding to improve patient safety and inventory management. In summary, information technologies are integral to providing safe care to patients and to everyone who uses these technologies. They are responsible to use them correctly, to evaluate them for risk to patient safety and to patient harm.